Hi there. So I wanted to make this video to do a follow-up. It's been 1 year and 1 month since I did the spinal fusion L5S1 operation. I feel good now. I have no problems. It hasn't limited my mobility. Nothing has changed since I did the operation. Obviously, the first few months after the operations, I was being very careful. The recovery is definitely long. I stopped taking medications after less than a month, probably. So I'm not currently taking any medications. Uh, Occasional Tylenol. Uh, 3 months after the operation, I did physical therapy for 3 months. Then after that, I went back for a few more months and back for a few more months. I think that 3 months after spinal fusion is very important to start physical therapy with a physical therapist that is really good. So, you know, the person who's doing spinal fusion definitely has to work on finding a good physical therapist, not the ones that just have the patient lay down, they put some, the electric thing, whatever it is, heat pack on them and let them be there for 20 minutes. I'm talking about a physical therapist that's gonna help you with exercises to strengthen the core. I'm definitely guilty right now. I stopped doing the daily, exercises. I was doing them every second day at some point. First every day, then every second day, and now I stopped. I gotta go back to that routine. Should you do a spinal fusion operation? If you are having problems, my problem was sitting. When I was sitting or driving, I would have sciatica type of pain in the back. My recommendation is if you ever are having issues like sciatica type of pain, nerve pain, it could be with walking or it could be with sitting. My definite recommendation is to spend 6 months or even more with a good physical therapist, because you might be able to solve the issue by strengthening your core. I think that overall, when you go to a doctor, they will definitely advise you to do that. And you should not lie to yourself. Just do it. Be strict. Once a day, physical therapist, not just, I guess usually what they do, they will give 3 days a week to meet a physical therapy, but I think that the person should do it every single day. So they should ask the physical therapist what exercise to do at home, and don't go online finding what to do. I would say, if you're dealing with this type of pain, sciatica type of pain, nerve pain in the back, go to a physical therapist and have them help you. They have to see what you're doing, because I remember I was doing certain exercises by myself, and then when I go to the physical therapist, they tell me I'm doing it wrong. The same thing happens when people go to the gym, right? They exercise at home, they do it wrong, but then when you go to the gym and you get the trainer, he can, or anybody else can see that you're doing it wrong. So it's the same thing here. Hopefully that works, and I think in majority of cases that will probably work and go away. In my case, it didn't. I spent 2 years trying to figure out what the problem is, and I worried a lot. It was really bad, so that's why I decided to do the operation. My other advice is go find yourself a good neurosurgeon. I did my operation in New York City at the HSS Hospital for Special Surgery. Yeah, great stuff. All the doctors there are very professional. The nurses, the staff, super professional, super nice, great experience. I have zero complaints. I'm really grateful that I had a good insurance that covered this operation. I was treated very well. The operation went well. They actually worked, I think, 3.5 hours on me. Yeah, when you wake up from that operation, it is super painful, especially like turning around. You realize how much you're using the back muscles. So the recovery is tough, but is it like horrible? I wouldn't say. It takes, it depends on the age, I guess. Maybe because I'm in my 30s, I was able to recover a lot faster. But overall, just do what you're told. I was actually given some physical therapy exercises that I was doing at home, very, very light one, mostly like sitting on the chair and doing them. I wasn't bending, twisting, now I can twist, I can bend, no issue. I mean, that's something that you can stop after 3 months. I was very strict on it. I walked, even though it was the winter, I did it in December. I walked every day, and walking felt great. Like, I mean, I would walk 3 times a day, 3 hours a day. So this just tells you how much you can do, just few weeks after the operation. Like, I think I was walking first in the apartment back and forth after a few weeks, and then I was outside walking, just doing circles. So this was during the pandemic. There was nobody outside, so I was just walking by myself. It's like I say, should you do the operation? If you went for over 6 months, I don't know, give yourself 8 months and do physical therapy, core exercises. If that doesn't help and you're still in pain, do not take medications, because I feel like the pain medications is the same as, let's say you having problems in life. You don't have a job, you're having some issues, so instead of going to find a job or going to a therapist to like work through your issues, you decide to get drunk every single day. I think that pain medications are that. So you're just kicking the can down the road, you're not helping your issue. I mean, if the pain is there, definitely take medications. But I don't think that anybody should be living every day. I mean, I was taking, what was I taking? Whatever they prescribed me after the operation. Like I said, definitely after the operation, you're gonna need that medication. Maybe, was it Oxycontin or, yeah, something, scary sounding like that. Because I mean, I was really thinking, should I be taking this? But after the operation, you have to. And then I just weaned off. I spoke with my doctor. I said, can I just stop taking them? I slowly weaned off of them, and that was it, And after that, I was definitely taking Tylenol, like high doses of Tylenol. Why Tylenol is much better for your stomach than ibuprofen. Ibuprofen can definitely mess up with your stomach. I already have stomach problems from before, so I wouldn't recommend. Tylenol is very safe for the stomach, so the only thing I was taking was Tylenol. I was given, what was the medication? It's like a nerve pain. I can't remember. It didn't even make any difference. But again, I'm gonna go back to the physical therapy. Your sciatica pain could be because of other reasons. So this is why you need a physical therapist, occupational therapist. So go to there's doctors, occupational therapists. I'm just gonna stop here, and I'm gonna apologize for making a long video like this. I just want to give all my experience, and I hope it helps with somebody who has this issue, because it was bothering me for over 2 years. The point of this video is, the most important thing is, do not take medications, do physical therapy, don't lie to yourself, do it every single day, strengthen that core and see what happens. It might not be the spine, it might be, how you call it, there's like so many things that could be the issue. I kind of went, and you have to confirm that with a doctor, occupational therapy doctor, physical therapist. They will do certain stretches to kind of see, to eliminate these possibilities. One could be the piriformis muscle could be bothering, could be pressing on the sciatic nerve. So the neurosurgeon told me, check out, maybe you should check out the piriformis muscle. That's what all the physical therapists are blaming sciatica pain on. So I mean, you can see that there's different theories, and you should before doing the operation check every single one of them. Could be the SI joint, so you definitely need to go to a doctor and see, is it the sacroiliac joint? You see, I never even knew any of this, but you know, going through pain for 2 years, I ended up knowing that. So spend a year, I would say spend a year physical therapy, double checking everything. I hope you have a good insurance. I mean, I spend a lot of money. I can't really, you know, when it comes to pain, you just don't, like, I wasn't enjoying anything. So what is the point of having money, you know, like, so, you know, like, again, I'm grateful I had a good insurance. So it cost me only a few $1,000s per year versus, you know, it could cost you tens of thousands of dollars. But yeah, that's all I can say. If after spending all this, doing your thorough research, you know, talking, if it comes to operation, I just want you to know that it's gonna suck for a few weeks. It's not gonna be unbearable. I'm telling you, I don't know what your tolerance of pain is. It's not, like, I went through it. It was, I mean, it sucks, but it's not like crazy pain. And like I say, now it's history. I don't even think about it. I'm still being careful about what I do. Like I say, I'm lifting the right way. I still haven't went to the gym, which I should. But yeah, it's not as scary. You go to sleep prior to the operation, you wake up, it's done. And then just you do what the doctor tells you to do, what's best for you. Turning around sucks. You definitely need somebody to be with you at home, to help you. You know, it's gonna suck at the beginning, but within 1 week, you know, you'll be doing things on your own. So I don't remember the details right now on the exact timing, but yeah, I would just say, if there's no other option, do it. It is not that scary. So that's all I have for now. And I'm trying to think. Yeah, that's all I can say for now. All right, have a good one. Good luck. Stay healthy. Bye.